Hello, hi. Today is day 6 of our daily NEET PG MCQ discussion. So, without further ado, let's start. Like we said, every day it's the same drill. We will post 20 to 30 questions in our Telegram channel, that is Medaffin Academy. And if you wanna join and participate in this poll and answer these questions, you can just click at scan this QR code which is there, okay, or you can also click on our channel link which I am placing it here in the live chat. Okay, if you are watching it live and if you want to invite your friends to this live stream, please, this is a link of the live stream. Yeah, the this is sixth day. We have like 5 days of material. What we usually do is every day at 8 a.m. we will start posting one question, and after that every 30 minutes we post questions, right? At 5:30 p.m. we will stop posting questions. We will give time till 7 p.m. every day so that all the questions can be answered by the participants. We started with low number, now our numbers are being are increasing daily. We will also post more number of questions in coming days, and our goal is to cover at least 1000 PYQs, previous year questions, and PYTs from last 7 to 10 years. I guess if you would join this channel now and just follow whatever questions have been posted in the channel, and at the end of the each session, that around 8:30 p.m. after this live session, we will post a PDF with all the question and answers and the explanation. So even if you go through that, that will be a great revision, and definitely it will improve your marks and rank. So even if you don't start, if you are a fresher, you just passed out of internship, you can just be part of the channel and benefit from this initiative. So without further ado, let's start the today's session. First question is: a patient with multiple nodulistic lesions on the face. Which among the following is a drug of choice in this condition? Okay. So today we will not be discussing the correct explanation. We'll just explain what is the correct answer, and if for you to have explanations, you can just join our channel, scan this QR code, or join by clicking on the Telegram link, and you will get the explanations. The correct answers for this is isotretinoin. Okay, we have 9 uh, NEET PG aspirants has given answer for this, and almost 9 has given the correct answer. Going to the next question, uh, this is the next question. Identify the anatomical variant shown in the CT. Okay, and this is the identification which they want you to identify, right? This is a CT scan of paranasal sinus. You can see turbinates, and you can see the sinus areas also here, and they want to identify this particular anomaly, anatomic variant. Okay, so the options given are pneumatized superior turbinate, onodi cells, halo cells, and concha bullosa. Okay, these are the 4 options, and out of the 4 options, 89% has given answer as pneumatized superior turbinate, and 11% has given answer as halo cell, and the correct answer is pneumatized superior turbinate. Okay, so it's the superior turbinate has air pocket in it, and this is actually a variant, anatomical variant of normal structure. So that's it. So it is given, it's not 100% correctly answered. So these are the questions you need to watch. And like I said, if you want full explanation, be part of this channel. Just subscribe to the channel. It is completely free. We don't sell anything. We are doing it only for the benefit of NEET PG aspirants who are giving 2026 NEET PG, right? So just join our channel. Coming to the next question. Standardized age mortality is an indicator for. The death rate of a population adjusted to a standard age distribution, that's the first option. Death rate of a population adjusted to a standard sex distribution, that's the second option. Number three is to eliminate age structure for different countries. Okay, that's a third option, and to remove bias due to the different age group populations in different regions, right? So if you see, 78% has given option A as their answer, and 11% and 11% has given option B and D. 0% nobody has selected the option C. So this is also one of the tricky questions. Even though it sounds very easy, people has given wrong answers. The correct answer is option A, death rate of the population adjusted to a standard distribution. Okay, the reason we are doing this is, you get chance to practice even before your exam multiple times. Even though you are doing multiple grand tests, practicing more will definitely result in improving your skills and improving your short term memories, improving your recall abilities faster and more, right? So that's the reason we are doing it. And definitely we are going to introduce more complex more complex MCQs into the channel. Okay, so if you want the correct explanation, please join our channel. Once again, same thing, you can just scan it or click on the link. Coming to the next question, when the cells lose the functioning of sodium potassium ATPase, it results in accumulation of sodium, calcium, chloride and water, and the loss of potassium from the cells. This is also the development, there is also a development of Gibbs-Donnan equilibrium. This equilibrium is mainly due to which of the following? If you see, everybody, like every option is selected, right? 10% has selected calcium, 10% selected as phosphate, 20% selected as bicarbonate, and 60% majority has selected it as proteins. So the correct answer is proteins, because proteins has this complex structure and they cannot permeate cell membranes. They will be the reason for this Gibbs-Donnan equilibrium. Okay, for full explanation, please join our channel. Coming to the next question. Mm, this is just what we are trying to do. Same thing every day, we post free MCQs and PDF at the end of the session. Coming to the next question, which fixation technique is used for fat in the histopathological examination? Okay, so we have IHC options as IHC. Preeti, I can keep for later at a time. Yeah, I mean, what we can do, Preeti, is even though, okay, no problem. So what we can do is every day, like, the questions will be posted at half an hour, right? So from 5:30 to 7:30, you have 2 hours. You can just join in the last 2 hours in the channel. Just give answers. That is also a great way. No problem. Anyway, we will be sharing the PDF in the group, so you'll be part of this group also. So that's a great thing. Thanks, Preeti, for being active participant in our Telegram channel. Yeah. Which fixation technique is used for fat in histopathological? I mean, they are showing. Okay. They are showing answers. Okay. I mean, they are okay. We can do questions as I missed today. Okay, okay. I understood. I understood. Correct. But like I said, like this is a live session. So you mean to say to mask these answers? If that's the case, we will try to do that also. Like we will try to mask the answers by others so that you can give your own answers. Yeah. Okay. So which fixation detection? Yeah, done. I will do it. I'll do it. Which fixation technique is used for fat in the histopathological examination? One is IHC, number two is frozen section, number three is liquid paraffin, and number four is formalin fixed, right? Four options, two, I mean, nine aspirants has given like answers for this, and out of this, six has given answer as frozen section, and three people has given as liquid paraffin. That's amount to 67%, 33%. So this is also a tricky question. The correct answer is frozen section. Okay, so for fat, F for F. See, for fat it is frozen section. Frozen section is a choice for histopathological examination. Coming to the next question, this is an image based questions. We do keep more image based questions, so that anyway text based questions or short questions will be mostly memory based. So we are keeping more image based so that it will help to manage the times and all. Yeah. Coming to the question, match the following. So there are four eggs, and relatively like they have given options of the names. Okay, so one, if you see like this, H nana, roundworm, hookworm, and tinea are the four organisms name, and they eggs. So the correct answer, I mean, there are four options. One is like, first option is one is D. This is D. Second option, I mean, two is A. Three is C, and four is, so three is I mean, it is not correct. This, the option is not correctly given. I think D, A, B. Three is B, and four is C. Okay. The second option is 1D, 2A, 3C, and 4B. Okay. So identifying eggs based on the morphology is one of the important topics, and even previously also in the day 4 or day 5 we have asked similar questions, which is related to uh, trichuris trichura, right? I guess that's the question, I guess. So I mean, like, easy to score, but you need to have hi Priya, thank you. Easy to score, but that's very important also, to make sure that you take your time and give answers. Okay, this is also a tricky question. At the end of the session, right, we will discuss how many tricky questions were there, so that uh, you can understand, like, these are the scoring places. You can either leave them or answer them, rather than answering them wrong. So the correct answer is one, option B. So first is actually tinea, second is actually H nana, three is actually C hookworm, and fourth is B roundworm. So total four. You know, for correct explanation, like, we will be posting PDF in the channel soon. Coming to the next question, this is also an image based question. This is an X-ray, and it is actually contrast based X-rays. Identify the name of the investigation shown below. So we have four options again. BAMFT, that's one option. The second option is barium swallow. Okay. Third option is luposcopy, and fourth option is barium enema. So if you see, like, if you see, it starts from the stomach area, so it cannot be barium enema. Enema usually is like done for colon and rectum and those structures. And if you see, there are a lot of intestinal loops, small bowel intestinal loops, which are being visible right now, right? So stomach and small intestines, those loops are visible. Large intestine loops are like very less. I mean, so the it can be a barium swallow or BAMFT. So what is BAMFT? Barium and Meckel's diverticum follow through. This is the name of the investigation. So 78% has given answer as barium, BAMFT, and 22% has given their answer as barium swallow, right? So the correct answer is BAMFT. So the correct answer for this particular picture, particular question is BAMFT. So it is actually a radiological investigation of the small bowel, and it is single contrast study, meaning it uses oral contrast, either barium or water soluble contrast, to examine the small intestine. So typically it is taken orally, right? This study is performed after an upper GI endoscopy and fluoroscopy studies, right? uh, it allows it is a part of the examination or study of what do you say, like, to diagnose certain things in small bowels majorly. So yeah, that's the image based question. Again, coming to the next image based question, this is a relatively simple question. Identify the image. Okay, when you can see there is multiple small wounds over the thorax and abdomen area, and we have almost four options: shotgun wound, rifled wound, butterfly bruise, and defense wounds, right? So it's a classic shotgun wound, like pellets are being spread out and hitting the target, and we all know that if the shotgun is very far away from the target, the more pellets will be spreading. If it is very near, the pellet spread will be little less. Yeah. So 89% has given correct answer, 11% has given wrong answer, right? Yes. Coming to the next question, 1,3 beta D glucan is helpful for identification of. Okay. So we have four options. Invasive, it is actually like I is missing. It's invasive candidiasis. Like we do, select these questions and schedule in morning and onwards. Like I usually select these questions based on the recommendations by expert. So in the morning, before the 8 o'clock, I mean, if it is 8 o'clock in India, it's almost 6:30 in UAE, because I work in UAE. So I wake up at like 5:45, something like that. I select all the questions, start doing the bones manually, because it is manual completely. So sometimes, like, we will miss some certain aspects, sometimes we'll miss pictures, but in the evening we will share all the things which are important. So four options: invasive candidiasis, second is rhizophus, number three is cryptococcus, and four is mucormycosis. Same thing, like 72% has given answer as A, and 14% as answer C, and 14% as answer D. And the correct answer is invasive candidiasis. 1,3 beta D glucan is helpful for identification of invasive candidiasis. That's the correct answer. Coming to, yeah, if somebody is watching this live, please give it a thumbs up, that will encourage me. And if you have friends who want to be part of this initiative, I will suggest, please uh, share our channel link. This is done completely for the benefit of NEET PG aspirants who are giving 2026. We are not selling anything, and we don't want to sell anything. So that's our motto. We are creating a very vibrant community. The channel, whatever answers you give, it is completely private. So at the end of the day, it is completely private. Even we also don't know who is answering which answer. Good. So that's the correct answer is invasive candidiasis. Okay. Coming to the next question, a patient presented with history of lower limb swelling. Okay. The diagnosis of filariasis was made based on the positive filarial antigen test. Which of the following should be done next in the management of this patient? Okay, we have four options again. DEC provocation test, that is giving drug and seeing the reactions. Number two is peripheral blood smear examination, that is collecting the blood in the night, usually like in the night, so that filarial they will be appearing in the blood in night times. So that's one thing. And scrotal USG, just to see if there are filarial in scrotum, and PCR. So 14% has given option as A, and 86 has given option as B, and correct answer is B. Peripheral blood smear is the next step. Then after that, the other things, the proper management will be taken. Visual diagnosis of filariasis through peripheral blood smear. Coming to next question, which of the following should be avoided by a patient with fish odor syndrome. Okay. So 1 minute. Let me put the channel link here again. Somebody wants to join, please join. Yeah. Which of the following should be avoided by a patient with fish odor syndrome? We have four options: biotin, choline, niacin, and pantothenic acid. Okay, so we 25% has given answer as biotin, 62% has given as answer as choline, and 13% has given answer as niacin. Okay, so the correct answer is option B, choline. Okay, so this should not be given in patients with fish odor syndrome because it has certain element amino acid uh, which aggravates this syndrome. So like foods containing these things like egg and all should be avoided. Coming to the correct explanation, full explanation will be there in the PDF. Coming to the next question, we have a 1-year-old child presented with anemia, hepatosplenomegaly, cervical lymph nodes, and multiple scalp swellings with full skull radiograph. He is diagnosed with multiple myeloma and has multiple lytic lesions on the skull X-ray. Okay, which of the following drug is commonly used in this scenario? So again, like six aspirants has given their answers. 50-50, 50% has selected vinblastine, 50% has selected vincristine, and the correct answer is vinblastine. Okay, uh, full explanation will be provided in the group. Yeah, coming to the next question. Again, it's another image based question. An elderly male presented with history of fall on outstretched hands. So outstretched hand, following which he developed swelling of the wrist. His X-ray is shown above. This is the X-ray. There are three views, right? Lateral, oblique, and anterior posterior, right? What is your diagnosis? 67% has given their answer as fracture scaphoid, and other 33% has given their answer as fracture scaphoid with perilunate dislocation. Okay, so I don't know if you can see this image properly, but if you are in group, you can definitely zoom it and see it. It is actually fracture of scaphoid bone. Outstretched hands, fallen outstretched hands, elderly patient, most of is one of the reasons for the carpal bone fracture, and most common carpal bone fracture in these kind of scenarios is scaphoid bone. Okay, so yeah, that's the answers. Answer is option A. Coming to the next, it's also one more image based question. If somebody is watching this live, please give it a thumbs up, like, comment below, and also share about our endeavors, our initiative with your friends. Let's grow our channel, and hopefully we will be giving benefits to more people in future. Okay, this is another image based question, and this is cross section of a CT scan. 40-year-old male patient with 2-year history of mucopurulent cough underwent CT chest. The CT scan is shown above. What is the most likely diagnosis? Obviously, the history itself gives the answer, right? Mucopurulent, 2-year cough. Most probably, he might be a chronic smoker also. The options were, and the particular pattern, honeycomb appearance, and all those things, right? See, the correct answer has been given by everyone. 100% has given the correct answer, even though it's an image based, maybe based on the history and image appearance. They have given correct answer as bronchiectasis. That's the correct answer. Cystic fibrosis is other option, sarcoidosis is other option, pulmonary hydatidosis is another option. Okay, so bronchiectasis is the correct answer because mucopurulent cough, a 2-year chronic history. Coming to the next question. Okay, so This is a cross section of a lymph node, and the question is what represents the marked area in the given histology of lymph node. Okay, so if you see these are this is the whole lymph node, and this is a part which they want you to identify. Okay, so we have four options again: marginal zone, paracortical zone, germinal center, and mantle zone. Okay, out of all the options, 50% has given answer as germinal center, 25% has mantle zone, and paracortical 25%. Okay, so they are pointing at inside this, circular thing. So it is actually germinal center, right? But here there is also a confusion, so we need to clarify this particular question. Okay, so the correct answer is actually germinal center. Cool. Coming to the next question, this is also an image based question. Whatever mistakes which are there in the questions, it will be rectified again, and we will post it. And like I said, please follow this channel. Most of the questions will be from the previous important topics, and definitely this will benefit you in one or other way. It refreshes your memory or improves your recall skills. Attachment and effacement, pathogenesis is seen in. Okay, what is attachment and effacement pathogenesis, right? We have again two of the options which are selected. 80% has selected EPEC, that is enteropathogenic Escherichia coli, and 20% has selected EIEC. Okay, that is enteroinvasive Escherichia coli, and the other two options were not selected, and the correct answer is EPEC. Okay, so and the explanation for this full with the reasons is given in the PDF. After this session, it will be shared in our Telegram channel. Okay, to be part of our Telegram channel, please scan this QR code or click on the link in the live chat. Okay, we will be doing, and this is 28, I mean day 6, and we'll be doing another 28 sessions or 27 sessions in coming days, and 27 sessions. So every day we will be posting 20 to 30 questions, and we will also give you some modules if you are staying in our channel, so that you can practice video based question. We are collecting so many video based questions, and you will be given that module for free, right? I just want you to be part of this channel, and you use this opportunity, because these are the new type of questions. Okay, coming to the next question, this is also an image based question. A 40-year-old woman presents with complaints of swelling of right breast over the past 15 days. See the history, right? 15 days only. On examination, there was a mobile lump over the chest part. What is the likely diagnosis? We have four options. One is inflammatory carcinoma, gained fibroadenoma, phylloid tumor, and galactose. Okay. Same thing, like 80% has given answer as inflammatory carcinoma, and 20% has given their answer as galactose. Okay, the correct answer is inflammatory carcinoma. 15-day history, and complaints of swelling and mobile lump. So, and the appearance is also one of the reasons. Coming to the next question, if the pH is reduced from 7.4 to 7.3 with PCO2 being constant at 100 mm Hg, which would be the PCO2, which line would PCO2 follow? And the correct answer is, 100% has given the correct answer. This is line 1, this is line 2, line 3, and line 4. This is normal PO2 100 mm Hg. Okay, if the pH is becoming more acidic, okay, what will be the PCO2? How the PCO2 will be like appearing? That's the question, correct question. Okay, So the correct answer is option A, and everybody, I mean, only 3% has given their answer, but everybody has given their answer, right? So please participate in this, event. Every day you can do it, as suggested by our community members. We will try to mask the answers so that people can answer it, and end of the day, like, you can have all the answers, so it will be great, it will be easy for everyone. Okay, coming to the next question, again I request, uh, if you, like, we will also try to do some Q and A's, ask me anything's, maybe in next week in Sunday, or we will be doing one grant test, live grant test, which was done, I guess, 1 week back. Similarly, we will do one grant test next week, most probably on Sunday, so that everyone will can participate in that grant test. We will do live grant test. At the end of the day, we will also see the scoring, right? How much scoring has been, what's the amount, what's the negatives, what's the score, what's the correct answers, and all. Okay, so we'll try to do that in next week, most probably 9th, 9th, next 9th we will do it. Yeah, so an overweight man, 90 kg, presented with complaints of not being able to squat and rest, and has rest pain, right, of left hip for 6 months duration. He had a past history of steroid and creatine use. Okay, these are the points. His X-ray revealed destruction of articular surface of femoral head with the presence of subchondral cyst. So this is also one of the thing, and positive crescent sign, right? His MRI is suggestive of marrow edema. What is your diagnosis? Okay, if you see four options, we have 25% given option as tuberculosis of hip, and 75% has given answer as osteonecrosis of femoral head. Okay, so the correct answer is osteonecrosis of femoral head. Okay, please be part of the channel, you will get the explanation. Coming to the next question, I guess this, we came to last two questions, and almost we are 32 minutes, so that's good. Like, I don't want to extend. That's the reason we are not explaining much, because if we start explaining every answer, right, like, the time will be very longer. I don't want to you to spend so much time on YouTube this time, right? So we'll try to shorten the explanations. All the explanations will be kept in the group, so that anyway, if you have doubt, you can just refer that PDF if you are part of that group. The picture of phonocardiogram and the chest lead ECG are given below. Which of the following marked areas point to the second heart zone? So this is A, this is B, and this is C. Okay, this is the ECG. Okay, uh, it the question asked is which point, which marked areas point to the second heart zone. So the first heart zone happens when there is P wave, right? Second heart zone happens when there is what do you say, uh, sorry, not the correct answer. Okay, the correct answer is actually, like, uh, first heart zone appears while closing mitral, and I think that's the correct answer. Even I got confused, but anyway, the correct answer is B. Sometimes it is like, uh, we will get brain fog. So the correct answer is B, and I guess the explanation will be there. We'll share the explanation. Even I will read it. Coming to the next question, this is the video based question. You can see, there is a tremor when the patient is bringing his hands towards his chest area. He is having more tremor, right? And the question is, I don't know, you can read it. It is very small, but I will read it. 20-year-old male is brought to the outpatient clinic by his parents due to worsening of dysarthria, resting tremor as shown in the video, and recent emotional liability causing a drop in school performance, right? On physical examination, mild icterus is noted. A slit lamp evaluation of the cornea reveals distinct golden brown depositions at the limbus. What is the primary biomedical defect causing this patient's clinical presentation. Okay, we have four options: impaired renal clearance of zinc, defective biliary excretion of copper, uh, decreased intestinal absorption of copper, defective lysosomal storage of iron. Okay, this is actually you know something to deal with copper metabolism. Okay, and the correct answer is defective biliary excretion of copper. Okay, and this is the name of the disease is like Wilson's disease. We all know that it causes all these symptoms along with the presentation of KF rings in slit lamp slit lamp examination, right? So KF rings, resting tremors, and particular tremors increases when the hands are at that shoulder level, and also emotional disturbances and decreased concentration. All these things are features of Wilson disease, and it is to do with copper metabolism in body. Okay, I guess we reached our end, and I am happy that I completed everything in 36 minutes flat. We'll try to even reduce that so that uh, yeah, like I said, please join the channel. This is our channel. If you have friends who are interested in participating in daily MCQs, ask them to join so that our channel will grow and people started giving more answers. It will definitely increase our enthusiasm to give out more. So this is the QR code, and please subscribe to my YouTube channel also. So that will definitely encourage me to work harder for for our healthcare professionals. And once again, Medaffin Academy is part of Medaffin ecosystem. We are building this Medaffin Academy to make sure that the students, MBBS students, and NEET PG aspirants will benefit from the current medical education systems and advent of AI. And the ecosystem is a bigger picture, right? So you being part of Medaffin Academy will automatically, you will be part of the bigger ecosystem, and the ecosystem will be the biggest in the world, and we are trying to make that. We are collaborating with multiple doctors from different countries, multiple healthcare professionals from different countries, so that the platform will be kind of global. Yeah, that's all. And this academy, we will be focusing more on education for MBBS students and people who are trying to prepare for residencies, right? NEET PG, or in future we also introducing USMLEs and all those other foreign courses also in our channel. Okay, not channel, I mean in our application. Right now we are not selling anything. It is for the whole concept is for NEET PG right now. So we are not selling any courses, nothing. Okay, so we will be giving out grant tests for free. If you want to practice, you can be part of this channel, and we will also give video based question modules for free. If you want to do that before the NEET PG exam, please be part of this channel. Okay, thank you, thanks for listening, and it's a great day. Have a nice day. Study well, read well, be confident, and relax. Thank you.